Thank you. Exciting to be here. We're all interested in our own health and the health of our parents and our loved ones and our families. And so when illness comes, we rely on our physicians to bring good medical knowledge to our treatment of health care. And the question for a physician is, will this drug or device help my patient? You can try to figure that out by looking at it up in the light like this doctor is doing, but even better, refer to the science, which in current times is found on PubMed, a .gov website maintained by the National Institutes of Health. When you go to PubMed, you find articles, and hopefully with medical training you can make sense of them, and they can sometimes present really good news, really powerful results that suggest a drug or device will be efficacious and safe. That's great. The problem, however, is that we now know that a lot of science is actually funded by the very drug and device industry that stand to profit from them. When you get to design your own science, that means you get to make a lot of discretionary decisions through the process. You have to decide what population will be tested on, how it will be assessed, which results will be reported, which statistics will you run, how the results will be characterized, and really whether to even publish the results at all. And there's just a small number of the discretionary choices that companies make. We know that industry-funded studies compared to ones funded by the NIH or funded by independent groups have more favorable efficacy results. They make the drugs and devices appear to be a lot safer, and the overall conclusions are much more positively emphatic. The systematic reviews suggest that this is a problem of industry bias of biomedical science. So when our physician goes to PubMed to find out the good news about the drug, the physician really should wonder if that good news is reliable. And the only way to start figuring that out is to click this full text link over on the right, and then you can find the full text of the article. And if you scroll and 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 scroll, eventually at the bottom you can find in small print funding disclosures. And it turns out this study that seemed to be such great news was in fact funded by the drug company that makes the drug. And not only that, they also paid one of the authors on the side personal income to do the study. This is permissible for lots of important reasons. We shouldn't necessarily ban this practice, but we should at least know about it when our physicians are making prescribing decisions. But it's impractical for physicians to do that. They neither have the time to go and read through entire full-text articles, but they also, it's probably too late to find a disclosure only after consuming the whole article. We know from the cognitive science that it's hard to turn back the mental clock. Instead, the conclusions will likely affect our judgment way before the disclosure could. So currently, our scientific abstracts are misleading. They're fronting the good news, they're burying the bad news, and physicians are making bad decisions. As a result, we get less health, but pay more costs. So the obvious solution is probably already apparent. We need to add those disclosures to the abstracts themselves because this information is material. It's important to evaluating the drug or device. We've studied this already and found that it can work. If we add these abstracts, disclosure to the abstracts, it can make a big impact on disclosures. I published a paper in the New England Journal of Medicine a few years ago showing it. But the journals have failed to do that so far. Turn over to Alex Chin.
So the team of developers that worked on this Chrome extension. We made a Chrome extension for physicians that simply scrapes the full text of the article, PubMed Central articles, and posts their disclosures, anything they reported, at the top of the abstract. So it's available before you read the full article.
We have it now live, running on the Chrome store. This is where for anyone with the Chrome browser, you can actually download and plug this in right now yourself. And I'll show you a demo here.
And I think Chris has talked a lot about the applicability and the necessity of this project. We made a Chrome extension. It's written in JavaScript. It's easily extensible. It's open source. We can also extend to other browsers with GreaseMonkey or TamperMonkey pretty easily. We pull results from real-time NIH databases, and
yeah. So we can go in lots of directions with this. We want to thank all the coders, the designer, Allie, and some other people that gave us lots of great input. Thank you.